I'd now like to introduce our speaker. Tiana received her Doctor of Pharmacy from the Leslie Dan Faculty of Pharmacy. Upon graduating, she completed a hospital pharmacy residency at St. Michael's Hospital in Toronto, Ontario. Tiana went on to hold a sessional clinical lecturer position with the University of Toronto's Faculty of Pharmacy, where she taught medication therapy management courses. Tiana is currently a clinical pharmacist and lecturer with the University of British Columbia's Pharmacists Clinic, which is part of UBC's Faculty of Pharmaceutical Sciences. At the Pharmacist Clinic, Tiana sees patients with complex medication needs, including individuals with Parkinson's disease. She works with patients and their other healthcare providers to make sure that they are getting the most out of their medications and to help solve medication problems. Tiana, welcome, and thank you so much for being here today to present for us. I will pass it over to you now.
Thank you for the introduction, and to the Parkinson Society of BC for having myself from the Pharmacist Clinic at UBC. And thank you to everyone who's joining us today for this session. I'll share my screen so that we can all see the presentation. Okay. So like was mentioned, I'll be speaking to everyone today about identifying and addressing non-motor symptoms of Parkinson's disease. And we'll go through some medication options as well as lifestyle options and some natural health products. And I'll be able to address questions that people have. If you have a question that applies to the whole group, then we can address it. If it's something that's more specific, then I'll talk at the end a little bit about how you can make an appointment directly with the Pharmacist Clinic for one-on-one or group appointments. So I will get started. And just a reminder that my name is Tiana, and I am one of the pharmacists at the UBC Pharmacist Clinic. Now, before getting started, I would like to acknowledge that the University of British Columbia, UBC, and the UBC Pharmacist Clinic are located on the traditional, ancestral, and unceded territory of the Musqueam people. And this has been a place of learning for generations of people, and we have the privilege to continue to do things like this where we can continue to learn on these grounds. I'd also like to acknowledge that you're joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands that you might be joining us from. Now, like I mentioned, we'll start by talking about non-motor symptoms, some lifestyle strategies, which we often try first, and then medication management options to address these issues, as well as natural health products, and then how to book appointments with the UBC Pharmacist Clinic. So briefly, I know many of you are probably quite aware of what Parkinson's disease is. So people are often aware that it's a chronic and progressive movement disorder where parts of the brain controlling movement aren't working properly. And oftentimes this happens because the brain cells that are making dopamine, which is a chemical messenger, become damaged and even die off. Now, with less dopamine, we have less signals traveling to and from the brain and reduced responses by the body. And these can be responses related to movement, which we call the motor symptoms, but it can also be related to non-motor symptoms. So those ones not directly involved in movement. And a lot of times people forget about these non-motor symptoms and that they can be related to Parkinson's disease. And so it can go maybe unnoticed or ununderstood and maybe even not even brought up with a healthcare provider. And sometimes this can result in them being untreated. So we'll go through a few examples so that you can kind of identify if these might be happening to you and track them, and then speak to a healthcare provider about them so that they can be addressed and hopefully improved, as well as an improvement in quality of life. Now, there are a lot of different potential non-motor symptoms of Parkinson's disease, and I've put together a slide here, a few of them. It's not exhaustive, but it is a lot of them. We won't go through all of them, but I've selected some key ones that come up quite a bit in our practice. Some of them include things associated with more of the brain, so things like difficulty sleeping or daytime sleepiness, memory issues, hallucinations, or even mood changes. And it can also have to do with other parts of the body. So things like increased drooling, runny nose, difficulty speaking or swallowing, low blood pressure, especially when standing up, muscle aches and pains in the body, things like constipation or bladder issues, so really affecting the gut and the urinary system, and then even things like sexual health issues. And lastly, things like restless legs. So a large number of potential non-motor symptoms, and not everyone's going to get all of these, but you might have different ones that happen throughout your journey with Parkinson's. And so these are ones to keep an eye out for. Now, before we get started, I'll do a bit of a true or false, and you can put it just in the chat box. So the first question is true or false. Caffeine pills should be the first thing I try for daytime sleepiness since it's available over the counter without a prescription. So this really has to do with the non-motor symptom of daytime sleepiness and how to address that. Okay, and I'm seeing some answers coming in. Right, so I see quite a few falses coming in. And you're correct, the answer is false. So we'll go over on the next slide that just because medication options or natural health supplements might be available, it doesn't mean we try that first. There's a lot of things that we can go to even before that from a lifestyle perspective, for example. So I know another session from another pharmacist focused really on difficulty sleeping. So do refer to that on the Parkinson Society's YouTube if you want to refer more detail to that. But on the flip side of that, you can also get things like daytime sleepiness. And this often happens because of changes in the areas of the brain that control sleep. And so there's a few options that we call kind of first line lifestyle changes. So some of them can be to try to exercise. So get up, walk around, do a stretch, as well as more lengthy exercise. So trying to incorporate things like 20 to 30 minutes of exercise into your day through things like aerobic, strength, and stretch exercises, and really staying busy. So keeping your mind active and engaged throughout the day, as if you're quite bored or not doing much, even sitting around, your body might feel even more tired throughout the day. Some quick tips to try to kind of perk yourself up include things like listening to upbeat music or even brightening up the room. So opening up those windows, turning on lights, opening the blinds to let that fresh air and light come in. Staying cool, so even doing something like splashing cold water on your face or even tapping it on the back of your neck, turning on a fan so you get that cool breeze or even opening that window. And then good sleep hygiene can go a long way as well. So setting a consistent wake up and go to sleep schedule so that you're really getting into the routine of when you'll be sleeping and when you'll be awake. Now, if those things don't work, that's when we might want to look into medication management strategies. So one of the simple strategies can be trying to use medications for motor symptoms that are more stimulating. So we know that things like razagiline and selegiline and even amantadine can actually cause insomnia. And usually we don't use them in the afternoon because of that reason. But for people who are getting daytime sleepiness, we can kind of use the benefit of that alertness to address this symptom. Other options can include trying to increase your caffeine intake, and that can be through a variety of ways. So it can be through trying to incorporate caffeinated tea or coffee into your diet. One glass of coffee tends to have about 80 milligrams of caffeine in it. Or you can even try increasing caffeine through caffeine pills. And that usually comes in about an 100 milligram tablet, where you could try taking that in the morning or even throughout the day. Just be cautious of not taking it too close to the evening time because it can disrupt your ability to fall asleep in the evening. And then lastly, if we need to move on to prescription medications, there are things like modafinil that can be used to increase alertness. Now, another common one that comes up is memory issues. And this can be due to a drop in dopamine, as well as other chemical messengers in the brain that are involved in things like thinking, memory and learning, and even attention. So again, and you'll see this many times throughout the presentation, one of the key ways to maintain memory and brain health are to incorporate exercise into your daily activities. Although the target is 20 to 30 minutes, 2 to 3 times per week of a variety of exercises, what we say is just start low and go slow and really listen to your body. So if you're finding 5 minutes, for example, is strenuous for you to walk, then start with something like 1 to 2 minutes and do that for the whole week. And then next week, see, okay, can I increase it to 3 minutes and then take a break and just slowly work your way up. We also want to focus on healthy eating. So avoiding things like salts, sugary foods, fats, and even alcohol, because those can have an impact on our brain health. Keeping an active mind, so continuing to do things like reading, puzzles, and learning new activities. Some people like learning new languages, other people might like going on walks in new areas. That's also something that counts as learning a new activity. You want to maintain, again, a good sleep schedule. So avoiding caffeine, especially in the afternoons or evenings, avoiding screen time, so things like TVs and cell phones, and even avoiding naps in the evening because that can make it difficult to then fall asleep at night. We also want to keep good cardiovascular health because the blood vessels that feed the brain need to stay healthy so that they can get blood and oxygen into the brain and help you maintain good memory. And so we want to do things like quitting smoking and also making sure that things like our blood pressure and our cholesterol are at good levels. So quitting smoking is a big one here. And then if these things aren't working or aren't slowing the loss of memory enough, then we can turn to medications. And the biggest two that I see for people who have Parkinson's are donepezil and rivastigmine. So these can be used to help with a small to moderate improvement in memory issues. Now, it's important to keep in mind that people's memory, even on these medications, might continue to have issues, but it's really about slowing down how quickly those issues are coming up. Okay, another common one is mood changes. And again, this is because the chemicals, including dopamine and other things that are involved in the brain are reduced, and these affect our mood. So in depression, this can be related to stress and sadness, also associated with Parkinson's disease. And from an anxiety perspective, this often happens with depression, and even often, especially during off periods. So if you're finding that your medications are wearing off, you might have increased anxiety at these times. So before the next medication dose, for example. Now, some lifestyle recommendations to address this are really staying engaged with family, friends, and your community. Again, exercising, it's good for your body, it's good for your mind, it's good for your brain. And then joining support and therapy groups and speaking to a professional. So reaching out to people like social workers, therapists, psychologists, they can really use different therapy approaches like talk therapy or cognitive behavioral therapy to help address mood changes. Now, oftentimes medications might be needed in addition to these lifestyle strategies, in addition to therapy. And the medications that we tend to go to for people with Parkinson's include nortriptyline and citalopram. And these are antidepressants that can help and might have a lower risk of interacting with other medications for Parkinson's. Now, kind of along the lines of memory issues are hallucinations. So hallucinations are hearing or seeing things that aren't really there. And this happens again because of changes in the brain areas that are involved in interpreting visual images. Now, at first, this might not occur, but over time, as you've had Parkinson's for a longer amount of time, these might happen or happen more frequently. When they first start, it might be just noticing different visual changes. So maybe a spot on the wall, for example, or an insect that you know isn't there. And it could become worse where you might see maybe people or children or even animals that you know aren't there. They might not be bothersome and you might be able to recognize really quickly that it's a hallucination and it's not real. As things progress, it might be harder and harder to tell if it's real or not. So if this becomes distressing to you or to your loved one, if you're the caretaker, then that's when we might want to start treating it. But if it's not bothersome and you're not worried, then it's okay to let it go untreated. Just take note about it and talk to your healthcare providers so they can also monitor it with you. In terms of what to do from a medication perspective, the first thing that we can try is lowering some doses of Parkinson's medications. This can be because the medications themselves could have this as a side effect. So that could be something we do a bit of trial and error with, seeing if with lower doses, symptoms are still controlled, but hallucinations are reduced. If not, or if they are reduced, but the Parkinson symptoms are really uncontrolled, then we have other options like using medications for memory and hallucinations, like the ribostigmine and donepezil, which we talked about for memory issues. Now, specifically for addressing like agitation and being really bothered by the hallucinations, we can use medications like quetiapine or clozapine, but they have more movement side effects. So we tend to start with ribostigmine and donepezil. Now, common ones being common non-motor symptoms include ones that have to do with the gut. So we might see things like nausea or even constipation. So from the nausea perspective, it can be due to a breakdown of nerves that are in the gut, so the stomach, the small intestine, as well as potentially from side effects of different Parkinson's medications. So we can address these the same way from a lifestyle perspective, regardless of what the cause is. One of them can be eating and drinking slowly and having smaller meals more frequently. So that could be breaking up, instead of having 3 large meals, something like 6 smaller meals. Avoiding activity after eating for about half an hour, as well as avoiding foods that are really greasy, fried, or sweet, because that can be more aggravating. Try to avoid mixing hot and cold foods together, because that can upset people's stomachs as well. And if it is related to medications, what we can do is try taking medications with a small snack or bland food or meal. So this could be something like saltine crackers or even plain bread, really to calm the stomach. Now, from a medication perspective, if it's caused by medications, oftentimes we might find that the nausea is lowered after a couple of weeks of taking a new medication. So it sometimes takes your body a little while to get used to the medication. So if you're finding that the nausea really seems to be happening at the same time or about 30 to 60 minutes after you take a medication, then try to keep with it if you can for about 2 weeks and see if it gets better. You can also implement some of the lifestyle techniques that we talked about to also help it get better more quickly. If it doesn't seem to go away with a few weeks, some of the things we can do are lower the medication doses and then try to increase more slowly to a higher dose once your body is okay with that lower dose. And lastly, if these things aren't working, we can again move to prescription medications. One of the most common one used for people with Parkinson's is called domperidone. And this can help avoid the medications that we take for Parkinson's working in the stomach and really having dopamine in the stomach, which can aggravate it and cause nausea. So it can help reducing that. The other option could be something like ondansetron. We do want to make sure that you talk to your prescriber and let them know that you have Parkinson's and you're on certain medications for that, because there are certain medications that we want to avoid taking because they can make movement symptoms worse. So things like metoclopramide, which can be used for nausea, but not in people who have Parkinson's disease. Now, we have another true or false. So again, feel free to put this in the chat box. And this is leading into our next non-motor symptom. Now, the question is, adding fiber to meals can help treat and prevent constipation. So true or false? Okay, so I'm seeing some answers coming in already, and that's correct. The answer is true. So adding fiber, I see a lot coming in, excellent. Adding fiber can help treating and preventing constipation, and there's other things we can do from a lifestyle perspective as well. So from a lifestyle perspective, we can do things like adding fiber to meals, and those can come from things like bran, lentils, beans, and prunes. It can involve increasing water and fluid intake. So what we like to try to remind people is 8 cups of water daily. So if you're someone who ends up having to get up during the night to go to the washroom, then I'd say try to get your 8 cups of water in earlier in the day, before noon or the afternoon, but really increasing the water can help that being pulled in, and it can make it easier to go to the washroom. Now, we also want to, again, exercise. Even things like walking 15 to 20 minutes daily or twice a day can help get your stomach moving. It can help make it easier for the stomach to contract and go to the washroom. Now, lastly, if you've tried all of these things and they're not working enough for you, then we can go to things like medications. And there are options available over the counter, like laxatives, bulking agents, and stimulants. And I'll go through some examples of these on the next slide. Now, what I want to really stress before we talk about those examples is that constipation is quite common, and it is an important issue for people with Parkinson's disease. Now, one of the reasons why it's important to manage is not only because of the discomfort and complications that it can cause, so things like hemorrhoids or anal fissures, but it's also because untreated constipation can actually lead to lower absorption and action of your Parkinson's medications. So keep an eye out for constipation. This can be when it's more difficult or requires more straining to go to the washroom, or if you feel like you're not completely voiding, those can be signs of constipation, as well as if you're finding that it's longer amounts of time before you have to go. So if you're somebody who regularly goes every 3 days, that's okay. But if it starts getting longer, then you know, okay, this might be a sign of constipation. Whereas if you're somebody who usually goes every day and now it's becoming longer, then again, for you, that might be a sign of constipation. Now on this slide, we have medications for constipation. And like I mentioned, there's different categories of them. There are laxatives, which you can use things like lactulose or PEG 3350, which might be called something like Laxaday or Restoralax. And this can be used, and it can start working in about 24 to 48 hours. So it takes a little while to see a response. Now, the other options that we have are things like bulking agents. So they can help make you void a larger amount, which can make it easier for your stomach to push it out. This can include things like psyllium fiber, which you can get in products like Metamucil. And again, can take a little while to work, so anywhere between 12 and 72 hours. And then lastly, we have stimulants. So that helps the gut really contract more and push things out. And they tend to work a bit faster. So in the 6 to 12 hour time frame. Now for the stimulants, we say to take it at bedtime, and hopefully by the morning, you should be able to void better. Keep in mind that for all of these medications, some of the common side effects are things like bloating, stomach upset, or even stomach cramps or discomfort. So see if things end up improving or if you have those side effects. You might also get diarrhea if the dose might be too high for you. So keep an eye out on it and usually start in the lower range of the recommended dose and then increase it if after a few days you're not seeing an increase in voiding. There are things that you can use like enemas that work more quickly in things like even 15 minutes, but those would be in cases where you've tried these medications and they haven't worked and it's now become more of an urgent matter. If you need any help picking a specific product, then speak to your pharmacist at the pharmacy and they can help you pick a specific one and talk to you about what dose might be appropriate for you. Now, another true or false question before we get into the non-motor symptom of aches and pains. So the question is, acetaminophen or Tylenol can be a good over-the-counter option for aches and pains. And this is specifically for people with Parkinson's disease. So feel free to put it in the chat. I see some answers coming in. Okay, so there's a little bit of, some people are saying true, some people are saying false here. So let's clarify this for everyone. So the answer is true. And I actually get a lot of misunderstanding and a lot of questions about this. And when we're looking at people who have Parkinson's disease, the go-to for muscle aches and pains is actually Tylenol or acetaminophen. Now, it's often the choice because it doesn't have other potential side effects that some other over-the-counter medications might have. For example, medications from the NSAID family, so things like ibuprofen or Aleve, those have more side effects on things like your blood pressure, your kidneys, your stomach. And so we go to Tylenol or acetaminophen as a good over-the-counter option. Now, before we get to using Tylenol, just like the other non-motor symptoms, we do have lifestyle recommendations. So muscle aches and pains can happen because there might be an increased sensitivity to pain in people who have Parkinson's disease, but the reason for that isn't exactly clear. Now, lifestyle recommendations including stretching your muscles, so again, that exercise we talked about, doing things like massages, especially in the area that you might be experiencing pain. And that can be something you do or interprofessional healthcare provider, like a registered massage therapist, might be able to help you with. And even things like a warm bath can help here. Now, you might also be able to talk to someone like your physical therapist or your occupational therapist, and they might be able to give you specific examples for stretching your muscles that have to do with your aches and pains. Now, if these things don't work, like I mentioned, you can go to a medication over the counter like Tylenol. What I like to recommend is actually Tylenol arthritis. It's 650 milligrams, and it's in a special formulation that lasts a little bit longer than regular Tylenol. So it tends to last 6 to 8 hours instead of 4 to 6 hours. So that can be a good option. What I recommend is that you don't use more than 3,000 milligrams or 3 grams of acetaminophen a day. And this is from all products. So if you're using acetaminophen regularly, and then you also get a cold and you take medications for that, just make sure that those medications don't also have Tylenol, because you can accidentally exceed the daily dose maximum if you don't realize that. Now, if you stay within this maximum suggested dose, you shouldn't have issues related to your liver associated with the acetaminophen. I know there's a lot of talk in the news and even in people about the dangers of acetaminophen on people's livers. That really is more if you have more than the maximum daily dose or if you have an overdose of acetaminophen. Okay, so if there's any questions related to that, because I know there is a bit of true or false uncertainty here, we can definitely talk about that at the end of the presentation. Okay. Now, the last few motor symptoms I have, or non-motor symptoms I'll talk to you about, kind of move down the body and move to areas like the legs. So this one is really restless legs. And again, often the cause is unknown, but it can be more severe in people with Parkinson's disease. And what it looks like is having an urge to move your legs, and it tends to happen more at times of rest. So if you're sleeping, or if you're even sitting down, maybe in a car, at the movies, you might be more likely to feel restless legs at these points. And it can result in your legs twitching or even kicking out, or feeling like you're getting a sense of aching or electric feeling, even itching or pulling of the legs. Now, there's a few, again, lifestyle things you can do to help. One of them is avoiding caffeine, nicotine, and alcohol in the evening. And there's a few different reasons for this. One of them is that it can impact your ability to sleep well, and then you might be disturbed by these movements. The other is that caffeine and nicotine can be stimulating, so it can actually cause you to have more movements as well. Another thing you can do if you're experiencing this and it's bothersome is to get up, walk around the room to try to move your legs, because that can provide temporary relief. Or you can even try to distract yourself. So try things like reading. Now, if those lifestyle interventions aren't working, we can also look at things like medications. And so one of them can be taking medications for motor symptoms at night. So levodopa, pramipexole, and ropinirole can be used more at nighttime dosing. So it could even be added just before bed. The other thing we can do is we can use a medication called gabapentin. And so this is if symptoms are really bothersome and occurring every day, and it can help with pain as well as the restless legs. Okay. Now, the last item I have here are sexual health issues. So Parkinson's can affect people's sexual response and also functioning, and less dopamine can result in a decreased sex drive or interest in sex. And so there's a few things that we can do from a lifestyle and medication perspective for both males and females. So from a lifestyle perspective, and you're probably getting tired of me saying this, but exercise can be a great way to get endorphins. Another thing is to consider different forms of intimacy. So speaking with your partner or partners about other alternatives that might be appropriate. And then working with a relationship therapist or even sex therapist to see if they can help coach you through these issues. From a medication perspective, you might be familiar with things like sildenafil or Viagra, and they may or may not be an option for you depending on other conditions you might have. And for women, we have things like hormone replacement therapy, where hormones might be able to help a bit with this as well. Okay. So now that we spoke about some of these non-motor symptoms, I'll speak about natural health products specifically related to non-motor symptoms. So when I'm talking about natural health products, I'm talking about things like vitamins, minerals, and herbal compounds, and they're often used to supplement your diet for different health reasons. Do keep in mind that while they can provide benefit, they aren't risk-free. So just because they're natural doesn't mean that there's no risks. Some of the risks can be things like side effects, like we also get with prescription medications. It can also interact with other medications, over-the-counter products, or natural health products. And it can also be costly, and it can contribute to how many medications you have to take in a day. And that can be a burden to some people. So keep these things in mind, as well as the fact that there might not be as strong evidence for certain natural health products in certain conditions. So talk to your pharmacist before starting a natural health product to see if it's safe for you and if there's evidence that these can actually help the symptom that you're experiencing and you're trying to address. Now, one thing that I like to tell people is if you really would like to try a natural health product, do try it if it's safe, but continue to monitor if you're having a response and what your symptoms are. If you haven't noticed a benefit in about 2 months' time, or if things ever get worse, then that's when I would say that's an adequate trial and to stop the natural health product. Okay, so some common natural health products that I get questions about or people are taking, but they're lacking evidence to help with issues associated with Parkinson's disease are on this slide. So if you're taking coenzyme Q10, omega-3, or vitamin E, specifically to slow the progression of Parkinson's disease, the Parkinson's guidelines don't recommend these, and that's because there's a lack of evidence for the benefit in this particular condition. So some people might use them for different conditions, but if you're taking it strictly to slow the progression of Parkinson's disease or for brain or memory health, that's where there's not as much evidence. So make an appointment or speak to your pharmacist about how you can see if it's right for you, or even stopping it might be right for you. Now, there's also natural health products that have some better evidence for non-motor symptoms of Parkinson's disease. So if you are looking for something with a bit more evidence for things like brain health, memory, or dementia, there is Ginkgo, where 240 milligrams once a day seem to improve symptoms of different types of dementia. So if you're going to do this, do use the 240 milligram dose, because that's what's been studied, and lower doses haven't been as effective. But do keep in mind, it doesn't necessarily prevent or slow the progression of dementia. It's helping specifically with symptoms of it. Now, there could be side effects, so do keep an eye out for those. Like we mentioned for constipation, there's medications, and Senicides are a natural health product that can be used. And again, that would be 2 tablets once daily at bedtime. For the daytime sleepiness, we talked about things like caffeine, which can come in either coffee and tea or even caffeine pills. I would start with 100 milligrams, 1 dose at a time. And if that seems to help but maybe wear off, then you can have another 100 milligrams later in the day. And again, being careful to avoid taking it at nighttime if it interferes with your sleep, or drinking coffee or tea at nighttime because it can lead to having to go to the washroom overnight. Now for sleep, I know we didn't cover insomnia too much, and there is another pharmacist who's done an excellent presentation on this topic specifically. So do refer to that for more details about lifestyle management and medication options. But if you're having issues with sleep, one of the options can be melatonin if you've already tried things like sleep hygiene. So sleep hygiene would be things like avoiding naps during the day or later in the day, avoiding screen time like television or cell phones, things that'll really stimulate the mind later in the day, avoiding exercise later in the day, but incorporating it earlier in the morning so that by the evening you are tired, and keeping a regular bedtime routine. So going to bed at the same time and waking up at the same time every day. Now, if you've tried incorporating things like that and you want to move over to a natural health product, then something like melatonin would be reasonable to try. Again, I would start at the lowest dose, so something like 3 milligrams daily before bedtime, and you could increase it to 5 or 10 milligrams if you're finding it's not enough. But be careful of morning grogginess or sleepiness. So you might find that in the morning, your reaction time is slower. So be careful, especially when you get up. If you're moving quickly, try to slow down. Prevent things like falls by removing items that you might trip over, and reduce the risk of accidents. So don't drive within about 7 to 8 hours of taking the melatonin the night before. Okay. Now there's also natural health products for bone health and Parkinson's. And we know that people with Parkinson's disease tend to have a vitamin D deficiency, so lower levels than regular people in Canada without Parkinson's, who themselves might have lower levels because we don't get as much sun in our country. So it's recommended that people supplement it with 800 to 2,000 units a day. This can really help your body absorb calcium, which is good for bone strength. Now, we want really good bone strength, especially if some of your motor symptoms lead to falls, to really prevent things like breaks. So you want to make sure that in your diet, you're getting about 1,000 to 1,200 milligrams of calcium, and that can come from diet as well as supplements. So a glass of milk, for example, has about 300 milligrams of calcium. So try to add up all the milk and yogurt and green vegetables. Osteoporosis Canada has a great calcium calculator on their website. Then you can use to see how much calcium you might need to supplement from a natural health product. Keep an eye out because a common side effect is constipation. So see if that's happening. And if so, talk to your pharmacist and we can see how to address it from a lifestyle and medication perspective. Now, the last natural health products I have here are probiotics, and they contain live microorganisms. And what a lot of people don't realize is that different probiotics have different evidence for different uses. So it's not really a one size fits all. And I've given you some examples of ones that have some evidence for different uses. So if you're experiencing something like constipation, then it might be Activia or Biogaia that could be used to increase and improve stool consistency and frequency. Whereas if you're having irritable bowel syndrome, so things like irregular stools, bloating, or stomach pain, you might want something like Align or BioK. Now, there's some evidence for the use of probiotics in weight management, to help reduce body fat and slim down the waist in people who are obese. And in terms of mood and affect, there is some relation of gut health to brain health. So there has been some studies looking at improving symptoms of stress and anxiety with probiotics like Calm Biotic or probiotic sticks. But the level of evidence here is less strong than for these other reasons for using probiotics. And it is important to keep in mind that it might be a natural health supplement that you might try to start with, but it doesn't replace the need for prescription medications and therapy. One of the common things that I see people using probiotics for in Parkinson's is actually diarrhea. And when we look at the evidence for probiotics associated with diarrhea, that evidence is more for infectious causes of diarrhea. So things like traveler's diarrhea, antibiotic-associated diarrhea, or bacteria that causes diarrhea. There isn't evidence for probiotics specifically just related to diarrhea associated with Parkinson's disease. Okay. And then in the last 5 minutes here, before we take some time for questions, and feel free to put them into the chat box and I'll get to them in a few minutes, is talking about the pharmacist clinic. So I know we did a bit of an overview today, but at the pharmacist clinic, we can provide additional education and really address one-on-one questions or small group questions. So the UBC Pharmacist Clinic was Canada's first university-affiliated licensed pharmacist-led patient care clinic, and it opened back in November 2013. It's grown to a team of about 6 clinical pharmacists, and we provide comprehensive medication management services. The goals of our clinic are really to provide the highest possible level care for patients, to provide a learning opportunity for health professionals and students, and also to engage in research related to pharmacy practice. And one thing that is different from our pharmacy than others is that we actually don't offer prescription filling services. So we could review your medications with you, but you would still fill your medications at your regular community pharmacy. Now our clinic is open Monday to Friday, 9 a.m. to 4 p.m. and it can be by self-referral or a healthcare provider that refers you to us. Right now, we're not doing in-person appointments, although we hope to return to those soon, but we do offer phone and video appointments at no cost to you. So we're a nonprofit generating clinic, and we're owned and operated by the Faculty of Pharmaceutical Sciences. And like I mentioned, we do one-on-one and group appointments. And you can book these either on the phone or online on our website or by calling us at this number. Now we provide expert support we work with you to resolve problems that you might be experiencing related to your medications to help you get the most out of them and really long-term health benefit. So making sure that over time, as your condition changes or progresses, new medications are started or stopped, you're continuously being monitored to make sure you're as healthy as possible. You can be assured that we'll listen to you and we include you in decisions about your health, so we won't make recommendations without you. And we can provide you with answers and information to questions that you might not have been able to get an answer or have time to be answered when you're addressing other things at other healthcare providers' appointments. And we do take a team-based approach. So we'll meet with you, but we'll communicate with your other healthcare providers to make sure we're all on the same page and there's no confusion in terms of plans. Our one-on-one appointments are a personalized 60-minute initial appointment with a pharmacist, as well as follow-up appointments that last 30 to 60 minutes, depending on your need. And we provide an overview of the complete picture of how your medications are working. And this includes prescription, non-prescription, supplements, and natural health products. And we can also develop detailed care plans to address issues that you're experiencing so that you don't experience as many side effects, but you do get as much benefit from your medications as possible. Now, some people say, okay, what does a patient who comes to see us look like? Well, there's no one specific patient, but we've had people who come to see us because they feel like their motor symptoms or non-motor symptoms aren't controlled. They might be overwhelmed with the number of times in a day that they have to take medications, or they might be experiencing side effects from their medications. It could be that their medications are wearing off, or that they're having other issues that are affected by their medications, like their mood or sleep. Now, in group appointments, a little bit different. We bring together groups of up to 10 people who experience similar health issues. So we have a specific Parkinson's disease group appointment where you can learn with and from each other. So it's a bit of a presentation and a bit of an engaged dialogue. And appointments run for an hour each month for 3 months. And we do have a fall and winter session coming up. The fall session occurs on Wednesdays from 6 p.m. to 7 p.m., 1 day a month for 3 months starting on October 6th. And in the winter, we have it on Tuesdays from 11 a.m. to 12 p.m., and that's starting in January, so January, February, and March. Now, the take-home messages from our presentation today: different people experience different non-motor symptoms associated with Parkinson's disease, and these may change within people as time progresses and goes on. Many non-motor symptoms can be addressed with lifestyle and/or medication interventions, both over-the-counter and prescription options. And pharmacists can help you address symptoms, discuss treatment options, and attend to certain side effects to help reduce them or make them more tolerable. So if you would like to speak with a pharmacist, you can always speak to your community pharmacist that you have a strong relationship with. In addition to that, you can book with the pharmacist clinic, either for the one-on-one appointments or for a group appointment if you'd like to engage with others as well. So I'll leave this slide up as our last slide in case you'd like to copy down the phone number or website, and I'll start answering some of the questions that we've got coming in. So one of the questions that came in is, Restoralax a good constipation aid? How often should it be used? Can I use it daily? So yes, Restoralax is another name for the PEG supplement that we talked about. Some people call it Laxaday or Restoralax. You can even get the generic option, that's okay too. It works just as well. And it tends to be 17 grams. I'll just open up the slide here. So 17 grams or 1 capsule. So usually the cap is a different color and it's a powder. So you can fill the cap with that powder and it'll give you 17 grams. You can put that into a glass of water, just dissolve it and then drink that. And that tends to be used once a day. So it takes 2 to 4 days to work, but some people will incorporate it into their daily routine. If you find that you're getting side effects, so things like bloating, stomach discomfort, or cramps, or even diarrhea, that's when you can say, okay, let me reduce the dose. So for some people that might look like reducing to half a capful, or it could be moving to a capful every other day. So play with it a little bit and talk to your pharmacist about what's going to work best for you, but that is definitely an option. The next question here is about the video on sleep. And so do correct me if I'm wrong, but I believe the Parkinson Society BC on their YouTube channel has the presentation specifically on insomnia, and it's in the series that I believe the pharmacist Amy put together. She also has some where she specifically talks about motor symptoms and medications, and they're really, really good presentations. Oh, and I see it here on the website as well. So also on the Parkinson Society BC website, you can find them there as well. Okay, and then another question coming in, are the group appointments done online or, done online over Zoom or in person? And so right now and for the fall, they're currently done online. In the future, and what we've done in the past before COVID was having appointments in person. So We'll probably continue with a bit of a mix once that's possible, but for now, we'll continue with online appointments. So we send you a link maybe 1 to 2 weeks before the appointment that you can click and join. And those are both people who have Parkinson's as well as care partners. They can also attend if you'd like. Okay, and then some questions specifically related to medications for motor symptoms. So one of the questions is, and this is a little bit different, but it's okay, we can answer it today. Is it possible for levodopa to cause dizziness? And that definitely is possible. So dizziness can be a bit tricky because it can be associated with Parkinson's itself, or it can be associated with different medications like levodopa. One of the things I recommend from a lifestyle perspective is to try to move more slowly. So getting up from seating or lying down more slowly, trying to use posture aids or support aids. So using a table to brace yourself when you're standing, or a railing if you're going up the stairs. From a medication perspective, what you can do is actually try taking the medication with food. That can help reduce the dizziness, although try to avoid taking it with protein. You can also try, like we mentioned, waiting to see if after a couple of weeks of taking the medication, your body gets used to it and the dizziness gets a bit less. And even like we mentioned for some other potential side effects, what we can do is start with lower doses of the levodopa. And then once your body kind of gets used to that dizziness side effect, then increase the dose a bit, because your body can get used to it and you can get less dizziness when you slowly increase that dose. So if you're trying to see if a symptom that you're getting, a non-motor symptom, is related to a medication or Parkinson's, there's a few things that you can look out for. One is kind of the timing. So does it happen after you take a medication? Then it might be related to the medication, versus if it's happening more when your medication's wearing off, that might be more of a symptom of Parkinson's. Also, try to keep an eye out for when it started. So is it that it's been ongoing and maybe even worsening over time? That could be your condition progressing. Or if it seems to have started after you started a new medication, that could be more related to the medication. And then you can also look at doses of medication. So if it gets worse when it's a higher dose, then it might be related to the medication. If it doesn't change at all with a higher or lower dose, then that might be more a symptom of the condition. Okay. I think that's all the questions that I see coming in. If that's about it, I'll just thank everyone for joining me and the group today for the presentation. I'll put our last slide up here in case you'd like it for reference, but thank you again so much for joining us, for participating in the true or false, and for asking your questions.
Thank you so much, Tiana, for that presentation. Very informative, and thank you so much for answering all of our questions. And thank you all for attending today and for posting your questions. And also just a reminder that we have Super Walk, and Parkinson's Society BC would like to invite you to join us for the 31st annual Parkinson's Super Walk this summer. Super Walk is the Society's largest fundraising event, and it helps fund our events, programs, support services, and advocacy efforts. And this year's event will be hosted virtually, with opening ceremonies taking place on Saturday, September 10th. So do learn more about it and register. You can visit our website at www.parkinson.bc.ca/superwalk. Thank you again, and we will see you at our next webinar.